As we've said, this month marks 5 years since the U.S. was first introduced to the ravages of COVID-19. While the pandemic itself is behind us, its impacts, of course, are still lingering. Some of the adaptations that we used to survive also remain.
And tonight we're hearing from local healthcare providers about the medical technology that we have now that might not have thrived otherwise.
Medical care just a call away.
If it's just a checkup, like to see how things are going, it just makes more sense that I'm not wasting time getting into a car and trying to get through traffic and all of that.
This service wasn't as prevalent before the pandemic.
Where telehealth was at, I was doing a lot of selling, convincing physicians and the health system benefits of telehealth. And at the time, it was really mostly focused on the hospital side.
Now it's a standard for so many.
It's this lifeline that patients can use to quickly be able to assess something.
CDC data shows the COVID-19 pandemic caused the spike in telemedicine use, with around 15% of physicians using it in 2019, pre-pandemic, but then nearly 87% in 2021. Novant Health's Vice President of Digital Health, Megan Huffman, says she was on a plane to Morocco in 2020 when COVID-19 turned the world upside down and forced so many, including her team, to innovate on how to provide care when many people couldn't or didn't want to leave their homes.
I got home and we ended up setting up a war room at the organization I was at. I wasn't at Novant at the time. To understand, okay, what are we going to do? How are we going to do this? And then not even 24 hours later, someone in the war room got COVID.
Turns out, she says, expanding telehealth was the way to go.
The healthcare community came together in a way I've never seen before, in that it was we got to figure out solutions and we got to do this for our patients and our providers. So it was a pretty remarkable time, but it was stressful.
Perhaps it's no surprise, but Huffman says AI is likely the next frontier for remote care, and also reimagining how telehealth can be offered in more settings and for more services.
What we found is patients do better in their house. They're comfortable, they're sleeping in their own bed. And so what we're seeing is the technology is meeting us in a way that we're able to have tests that can be ran from a portable perspective if we have the right kind of folks visiting nurses at patients' homes.
Serving more communities and potentially easing the burden of the nursing shortage.
How can we create some digital or telehealth capabilities in our hospitals to take some of that pressure off of our boots on the ground staff who are doing the hands-on work every day and provide them with some sort of outlet or some sort of reprieve that can help with their day-to-day tasks.
And so, speaking of technology, our executive producer, Spencer Collins, and I were talking as we were putting this piece together about how we've changed a lot too, and how we gather interviews as well. And, doing the remote interviews via video, while it took some getting used to, it was a totally different process for us. It opened the doors to, for example, who can you talk to across the country now and get in expertise from maybe not just within your one city area.
Yeah, broadens things up for sure in that way. All right, well, more to come on that.